Hello again. So I think my MI skills have improved and how my consults can be better. The learning that I had is how to ask open questions during an assessment. It will help me to get more information from the patient and to discover the main reason for their behaviors. I used to didn't ask that much because I didn't want to be that personal. But now with the with the MI information, I realized that it's okay to change the question and don't make only closed questions. Open question will be better because I can recollect more information. So the areas that I need to focus on are discovering what the patient likes and how their self-esteem is. Talking about the likes, I'm talking more like if they like to do exercise, if they like the diet that maybe the physician give it to the patient, and that will help me to understand the behavior of the patient. And even though I can, with the MI, I can know if the patient really wants to change or it's only because somebody referred the patient to me and he only wants to comply with their family or probably with the physician. And yeah, and MI has not impacted my life right now. However, I think MI is going to help me a lot in my clinical hours. It will help me to have a better interview with the patients at the hospital. And additionally, I have to learn more skills from the MI because it's a lot of theory behind the MI. It's not that easy as we think. And knowing all the skills that I can have with the MI, I can feel more confident about what to ask to the patient. And as I mentioned before, I can ask more, but I don't have to be that personal. And I think I have to practice responding my MI answers because during my interview with Emily, one of my classmates, she answered one thing that I didn't expect. I think I asked how was her family support or something like that, and she was answering me that, oh, I live by myself and my family is not around, to be honest. And I was on blank because I didn't know what to say next, and I overthink, and I think I have to work on the ways that if the patient would answer me something that I don't expect. So I need to practice on that. And I think as a future dietitian, I will try to not to use the intuitive eating. I used to do it, or most of the time I do it. When I try to maybe change all the carbohydrates for proteins and try new diets like keto or other diets. But as a future dietitian, I want to include all the food and make the portion correctly. And I think the intuitive eating has benefits, but in a long term they can affect their health, and I don't want to be remembered that way for my patients. So I will keep it on the side. And it was really interesting to know more about this topic, and I really like it. Thank you so much.